Hello, everyone, and welcome to another edition of your Rehab Power Hour. This is your community to engage in virtual rehab together and a place to discuss all things neuro rehab, from the science, the people behind it, and the individual journey of recovery. I'm your host, as always, Dr. Nick Housley. Thanks so much for being here. I hope you have had a great week so far. And I have a couple of really great guests tonight, and we will get to their questions in just a moment. But before we get started, a couple of high-level announcements, and just as a quick reminder, as always, we welcome everyone recovering from neurologic injury, their friends, family members, or care partners, as well as their clinicians, to engage in this group with us and answer or ask any questions that are really interesting to you. As always, there's kind of three ways that you can get in touch with me during the Rehab Power Hours. The first of those is actually in the live stream. So if you have questions or comments, feel free to post them in the Facebook group, and I'll be watching that as we go along today. You can also give me a call at 404-594-4244. We'll be sure to post those in the chat as well. You can leave me a voicemail, and we'll be sure to answer those questions on the air. Also, if you don't have the time to ask those questions now, you can always ask me these questions anytime. So feel free to call that number and leave a voicemail. You can also email me at rehabpowerhour@motusnova.com. And again, if you have questions offline, either the voicemail or the email will get to me, and we'll be able to talk about those questions or comments or suggestions for the next Rehab Power Hour. Also, if you'd like to be on a Rehab Power Hour, either as a guest or you want to come on and tell your story to the community, I'd love to have you on. And just let us know through one of those means of communication, and we'll be sure to schedule you into the next session. I want to quickly remind everyone that we do have a live session going on right now. So if you have your Motus Hand or Motus Foot ready, and you can go ahead and power that on, and in the window will pop up that will welcome you to join the live session. This is basically a shared prescription that we can all do together. So it's another great excuse to actually get another hour of rehab in your schedule. If you don't have access to a Motus Hand or a Motus Foot, no problem. Go ahead and bring out your home exercise program, and you can actually use this opportunity to get more rehab while we keep you company. I just want to encourage you, though, if you are doing your Motus Hand or Motus Foot rehab right now, make sure you do stay engaged, and we will just kind of keep you company in the background. And we know it's super important for you to do more and more rehab, but it's also really quite important to be engaged in that rehab. You know, those kind of the two sides of the coins of good progress is not only just the amount of rehab you're doing, but it has to be good quality. Okay. Now I want to actually do a couple of congratulations here. Actually, one congratulations since our Wednesday session. Gail in Texas was able to hit her 30-hour challenge benchmark. So congratulations, Gail, for hitting that benchmark. It'll be a great custom t-shirt that indicates that you are a 30-hour challenge champion that will be sent to you in the mail. If you guys are not familiar with this process, there is a 30-hour challenge, sort of a goal that we set out for all of our new Motus Hand, Motus Foot users. That really is a representation of our sort of realization, our acknowledgement of the importance of the hours of rehab. So if you're able to get an hour of rehab a day, around 30 hours in that first month of your new subscription, there'll be some great prizes that get sent to your way. And if you haven't received one of those yet, and you have the 30-hour challenge, let me know in the live stream here, and also give me your shirt size, and we'll be sure to send you one of those in the mail. I think we actually just posted a cool picture of James actually getting ready to send all those out at the end of this week. And so you guys should be looking out in the mail, and we'll be, hopefully you guys will be receiving those very shortly. Okay, everyone. I also want to remind everyone that we do have a couple of contests going on right now. Let me go ahead and pull up these details here. And so the details, we got two new ones. There's one that you can actually join with respect to a submission of your assessment. So let me actually pull this up. I think I have the details here. Okay. So it looks like we want to have there's two ways to join. The first is actually, both of the details are found on the Facebook or the Instagram account. The first of those is actually a quick assessment where we ask you a very simple question, sort of your perception of your motor recovery. And that's a fairly simple thing to do. The other one is actually you submit a 60-second or less video about your recovery process. And so do look to the Instagram or Facebook groups about the details for those specific opportunities. Okay. And I'm going to quickly go over to our first guest. I think we are going to go over to Robert and Jodi. Robert and Jodi, can you hear me?
Yes, you can.
Yes.
Excellent. Very good, guys. And we actually were chatting a little bit before Rehab Power Hour got started formally. And so we're having some great discussion about the donning process. and how to actually put the hand mentor or the Motus Hand on appropriately. And so before we kind of get back into those details, if you guys wouldn't mind, maybe just start off by introducing yourself, where you're calling from, and tell me, Robert, when you had your neurologic injury.
Well, we're here in Somerset, New Jersey,
Mm-hmm.
and I had my stroke about 8 years ago.
Okay. Well, Robert, tell me a little bit about your experience with your rehab so far. What have you been doing since you're?
Well, I go to a specialist, a gym where the guy works a couple of brain patients, and most of it is about my gait, my walk. And I ran the 11 New York marathons. So that was my goal, to get back to running.
Okay. Well, how are you on that path right now?
It's a process.
Sure. Yeah. Well, it's this is one of the things that we need to be honest with ourselves. Oftentimes, neuro rehab is a longer process than we would hope. All right, I talked about this on Wednesday. I would love the ability to snap my fingers and have every impairment
There's
go
no
away.
magic pill.
There is no magic pill. You're exactly right, Robert. It does take a lot of hard work, and so you've been doing rehab. Are you doing that presently still, or was it something that?
Yeah, I go 3 times a week.
Okay.
3 hours.
Very good.
Yeah, it's a pretty intensive. He beats the hell out of me.
Okay.
It's not, customary stroke rehab. He
Okay.
trains elite athletes, and our friend was a trainer there. And like, he has his physical self is there, and it's just the connection. He has a lot of fear. So his trainer will have him standing on a skateboard to show him that he has how much weight he has to put on his right leg in order to step down onto the ground without the skateboard moving.
Yep.
Because Rob likes to walk and put all his weight on his left and sort of roundhouse his right around.
Yeah, we call it circumduction, and that can actually cause some challenges to balance. So that's a really cool strategy to kind of really challenge your what we call sensory motor abilities. That's kind of a cool technique.
Yeah, and he has to, because of his executive dysfunction, he has to do things and come up with creative ways that Rob can't. We call it robber size.
I can't cheat.
That he can't cheat. So this is, if he steps off and he doesn't have weight on his right foot, the skateboard is going.
Oh yeah.
And I've been.
Yeah.
Yep. That is that's what we call really, really powerful biofeedback. Pretty quickly when you messed up there, right?
Yeah. Right. When you kiss the floor, it's not good.
Yeah.
Exactly. That's a pretty strong signal that, hey, let's not do that again. Yeah.
Pretty much.
Yeah, and that's actually kind of a similar process here with what we, of course, we're not encouraging anyone falls on the floor, but with respect to something like the Motus Hand, it's exactly kind of working on the same principle where you have to use the right pattern. You're encouraged to use the right motor pattern to actually complete the tasks. Because unless you're using your other hand, like in your case, Robert, we encourage you not to use your left hand to help you do the task, right?
No, it wouldn't make sense. I don't want to cheat.
Yeah, that is cheating, exactly. And so the Motus Hand is really designed to kind of help you get past that point of you're able to have some help with the Motus Hand with respect to the actual assistance on it. But it's also going to tell you when you do something correctly or not correctly, right? Because that's that biofeedback. Very much like when you get the information from, you get that sensation of falling when you start to do the motor pattern incorrectly when you're stepping off the skateboard. You're going to get that biofeedback delivered to you on the console. And so that's I know you guys are just sort of brand new getting the Motus Hand, but I hope that's something that you guys will be able to appreciate over time as you start to use it.
Yeah.
Yeah. And so I think maybe we can kind of continue the conversation we were having before we started here. So we were talking about some of the important aspects of the donning process. And so the donning process, this is a fancy clinical term that means to put on. Right. It's really nothing special, but it's just a way to encapsulate a lot of terms. And we were talking about how sometimes it's challenging, especially if you have either a lot of tone in one case or a lot of, if there's a lot of plasticity in the other case. So I think both cases on the extreme can be a little bit challenging to put on independently. And there's, of course, a learning curve. And many of you who have been using this for a while know that there's a little bit of a learning curve. And I do encourage you guys to try to find strategies that kind of work with your specific anatomy, your specific impairments. And so we were talking about one of the key ones we talked about before is actually don't have to move your arm necessarily to put the hand mentor on, the Motus Hand. You can actually use the Motus Hand. It's kind of a freely moving thing to put on you. So instead of you manipulating yourself to fit onto the Motus Hand, you just manipulate the Motus Hand to put on you. That's what we were talking about. Go ahead.
Yes.
Ooh, I think we have another individual. Sorry, guys. Jodi and Robert, you still able to hear me?
Yeah.
Okay, yeah, very good. So we were just talking about the process of, I'm going to move my shoulder up here just to show you, but you can imagine instead of just trying to put your hand through the Motus Hand, you actually will move the Motus Hand up vertically. That way you have a kind of straight line path to put it on, and then you can manipulate this around. So we're talking about that step. And we were onto the process of actually making sure we had good coverage here, right? And I think we were kind of on that step. We just paused here briefly. And I think one of the things I want to underscore, guys, is the importance of having good coverage of our fingers. So I hope you guys can appreciate this, where I have a little bit of, my fingers are kind of exposed there. You can see my fingers just coming through the bottom of the clamshell. And we really don't want to have this happen, because what's gonna happen long-term is you're gonna be really effortful, going up and down, really moving your hand and your wrist, and you're gonna end up actually pulling out of this, okay? So what I wanna do instead is you wanna focus on having a lot of good coverage there. So I shouldn't really be able to see my fingers at all, okay? And if it depends on the size of your hand, of course, there's different size bodies. But if most of the time we'll be able to see some version of our fingers in the top part here. Okay. So this is our first step. And the next thing I want you guys to do, Robert and Jodi, is to check your alignment. One of the key things is we need to have our wrist. So my wrist is about here. You can kind of use a pinch of your left side there, Robert. You can do this yourself. I actually encourage you to do this. And you guys don't have to, of course, move the hand mentor up like this.
Can I answer a question?
Sure. Yeah, go for it.
My stroke was, I was a left-handed person.
Okay.
Is this thing built for, let's say my stroke was on the right side. Would it be easier training with the what am I saying? I think the brain is like affected.
Sure. So like you had if your right side is impaired, right? You had a stroke on the left side of your brain, right? Crossing. And I think what you're asking is, does your dominant side, if you have a stroke on the contralateral side, so like for me, instance, Robert, I'm right-handed with writing and those sorts of things. If I had a stroke on my left side, would I be more or less impaired? Is that what you're asking? Or are you asking about the recovery process?
The recovery process.
Sure. Yeah, this is a really good question. I think generally speaking, individuals who have impairments, ipsilateral. So let's say I had a stroke on my right side, my left side would be impaired. I would have actually a little bit less good outcome. And so I think that's really just because I would sort of rely more on my dominant side, and I would have a little bit more function. Now, the truth be told is that we call them dominant and non-dominant sides. The truth be told, there's some really beautiful scientific work out there that shows that both sides are actually quite skilled. They're just skilled in different ways. And so we might call like my right side, I'm dominant, right side dominant, but my left side's actually quite skilled. It's just skilled in different ways. And I don't have to go into the details about this, but there's some really nice stuff out of UPenn and those guys up in Pittsburgh. But yeah, there is some dependency about which side of the stroke is and how it influences your precision arm. That's what we like to call them in the actual formal scientific world. It's called your precision arm and your stabilizing arm. The way you can kind of think about this is if you have a loaf of bread and you have a knife, and you try to cut the loaf of bread with a knife, my left hand is my stabilizer and my right arm is my manipulator. And so if you have a stroke on your manipulator side, it generally influences you a bit more than your stabilizer side, because the stroke will generally impact the fine motor skills to a greater extent than the sort of gross motor skills. And so you can imagine some dependency on the long-term recovery if you have a stroke that impacts the side of your body that generally does more fine motor skills, things like writing or manipulating. So there is some dependency there.
Okay.
Hopefully that answers that question. Like I know it kind of got into the weeds there about differences in precision versus stabilizer arms, but hopefully that helps.
If, let's say I'm eating,
Sure.
I use the fork with
So,
my
I
left
think
hand
what he's saying is,
and the knife is in my right hand.
Hmm.
I want to cut meat. So is it better? Should I have had a stroke on my left side?
So let me ask you this question. If let's say, imagine you before your stroke, what would you use to brush your teeth? What arm
My
would you
left
use?
hand.
Your
My
left
left
hand?
hand.
Okay. So you had a stroke on your left side, and your right side, your right physical side, your left side of the brain was what the stroke was. So you're in a better situation than if you had it the other way around.
but
Because
not for recovery, because he doesn't even acknowledge or think about doing anything with his right side.
so this is the challenge. When we talk about recovery, it's a little bit tricky, right? When we talk about overall function, individuals are better off to have a stroke in the case that you.
Oh, right.
Yep. But if you're talking about necessarily the drive to induce those changes, yeah, people can generally be more motivated if they have the stroke on the side that impacts their fine motor skills or their classically called dominant side.
Right.
I think there's a number of factors too in outside of just that sort of preference, but I can see some rationale in that sort of thought process. All the more reason to have something that would encourage you to do more movements, though, Robert. Because we know that we can get that recovery. It's just a matter of trying to get the number of movements that are required to induce those changes.
Mm-hmm.
Okay. So I guess since we have the Motus Hand on, so let's make sure we have that alignment. I think I was talking about that really quickly. So with respect to the alignment, we want to make sure that these two joints here of the Motus Hand are lined up with my arm, with my wrist. You guys don't have to actually hold this up. You can actually do this yourself, Robert. So take your left hand, and you can actually just use a pincher grasp like this.
Yes.
So you just relax your arm, Robert. I'm just holding my arm up here so I can show you with a video. But all you have to do is take like your thumb and your index finger, and I want you to feel in the hand mentor in the Motus Hand where your wrist is. Yep.
His wrist underneath the mantle.
Yep.
Yes. Right.
And the thing is you can imagine drawing a line straight through this right here, my wrist. You want it to line up with this guy here. And for me right now, this is not a good alignment. I want to actually be quite a bit farther down. And so I want to be more like that. That's much more in line with me. And the way I would check this is I would actually just do a little bit of a pincher grasp here and see if that's aligned. I think it's hopefully easier to see like that.
Yeah.
Much easier to see in this perspective.
Yeah, I think I'm good.
Okay, very good. And the one thing I do want you to make sure though, Robert, is once you find that good position, make sure these two black screws on the side here are tight.
Yeah, we did that.
Very good. Okay, so then once we have that process done, and I actually saw you guys just got this today, or maybe today or yesterday, is that correct?
This morning.
This morning.
Okay, very good. So it actually looks like you guys have everything set up right now. And so I'm actually going to go through a quick check. If you wouldn't mind, go ahead on the left side of your screen, go ahead and press the telehealth button.
Okay.
And then go to assessment. Okay, very good. And so what we'll do, Robert, is I'm going to go ahead and check a couple of measures here. We're getting nice data here. Okie dokie. So I'm going to have you try to move your hand up and down as far as you can. And if you can't do it, that's totally fine. It's just this is a good baseline.
Okay, now.
Please, yeah, whenever you would like to start. Okay.
Yeah. What are you doing with your left hand?
If he's just stabilizing it, that's okay.
Okay. Yeah, I think we'll go ahead. Go up.
I'm trying.
Okay, and then relax, Robert, and then we'll go up as far as you can. Very good. And I'm actually going to quickly check your, let's see here, go back. And you just get to relax. I'm actually going to kick in here and do a passive check to see how much tone you have in your arm, okay? So you let me know as soon as you feel the Motus Hand move you. So you're going to hear the pump kick in. That's okay. But I'd like to actually have you close your eyes. And I want you to tell me as soon as you feel, don't rely on the actual pressure, don't rely on the sound rather, rely on when you feel the Motus Hand move your hand for the very first time. And this is actually a multifaceted test here. We'll be evaluating the tone of your arm and your hand, but simultaneously.
Now.
Very good, okay? And you can actually open your eyes up for the rest of this. That's actually just me testing your kind of discrimination of your senses. And so this is actually quite important too. This is a good check. So Robert, the next thing I want you to do is tell me as soon as you feel the hand mentor start to give you a stretch. And it shouldn't be uncomfortable, but just let me know.
It's stretching now.
Okay, okay. Is it uncomfortable or is it still comfortable?
No, it's fine.
Okay, very good. Okay, dokie. We'll keep going up here. And actually, I already saw, based on the data that you did today, that you're already able to move a fair amount with assistance, which is really good. But we'll just make sure to do a sort of a final confirmation here about the total ranges of motion. And Robert, do you notice any differences in the day, like tone in your arm and your hand? I know you mentioned when you were starting to put it on.
At night is flaccid.
Okay. How about when you get up at first thing in the morning?
Yeah, it's kind of flaccid there.
Okay. Okay, very good. Fairly happy with this. How you feeling there?
No pain.
Okay, very good. Yeah, my rule of thumb is none of this should be painful. So I'm going to bring that out. We'll check that. So I'm actually going to go ahead and put us up to a certain amount here. I'm going to change a little bit of our settings because I can see you can actually move a little bit further than the baseline from today. So what I want you to do is actually go ahead in the top left, hit the back button for me. And I know you already did some therapy today, but I want you to go ahead and start a couple of sessions here. So go to home, top left, and then go ahead and hit begin therapy. And what I'd like you guys to do is to go through a couple of them and just see the new settings, okay? I made a couple of modifications to them, and let me know as soon as if it feels like different at all, and I want it to actually work for you in your actual therapeutic exercises. Right. So just go through a couple of them and just and check how things are going, okay? Okay, so I'm actually going to go over, I want you guys to go ahead and continue through. I'm going to go over to one of my next guests, and I will come back in just a moment to check how things are going, okay? Okay, very good. Well, I just want to quickly reintroduce everyone here. My name is Nick Housey, and this is your Rehab Power Hour, so thanks so much for being here. I'm going to go over to Betty, I think. Betty, can you hear me?
Yes, I'm here.
Hey, Betty.
It's actually Betsy, but that's okay.
Oh, okay, yeah, Betsy. Sorry about that. Betsy, how can I help you today?
Well, my brother-in-law had a massive MCA stroke, right-sided, in December, and his progress has been suboptimal, secondary to COVID and everything. So we finally have him in a rehab place.
Okay.
He has his left arm is totally flaccid. There's no mobility, but he does have sensation.
Okay.
He does have some subluxation of his shoulder as a result, which impedes the range of motion.
Yep.
He has very little mobility on his left leg, except from the hip.
Okay.
But our goal is hopefully to get him walking sometime. And we're a little nervous because it's now almost 6 months out and we're not getting you read all the literature that says he needs a lot of repetitive motion. We're just not getting that. And we're kind of looking for, once he gets out of the rehab he's in right now, what do we do next? I mean, how do we get him to progress? And when I was reading literature, it said that even people, I mean, they at first you read it like if you don't get it within 3 months, you're never going to get it.
Yeah.
And now I'm seeing, well, maybe you will with devices like you are describing. So we're just kind of looking to see what do we do now to help this guy that up until 5 months ago was kayaking, hiking,
Sure.
Totally active. And now we're not making the progress we'd like to be able to see. So
Sure. Yeah. I mean, first of all, thank you so much, Betsy. It's really great that you are trying to be an advocate. I think that's a key, right? Not everyone is as fortunate, and it's good you're looking at all the options. And so I think one of the things that I want to mention is that progress is often slower than we expect, right? And it's going to be very, very hard to predict exactly where kind of the end goal is, right? We can kind of get some idea about where that's going to be, but it's going to be very, very hard, especially early on. You kind of, it's a lot of variables can be in play to kind of dictate where that long-term progress is going to be. And I think, yeah, I'm seeing some responses here in the live stream here. We've got individuals who are 10 years, 20 years post-injury, and they're still making progress. And so I know it's, you guys are kind of in that first year, and I want to encourage you to really, I don't want to say not listen to, but I'd say you have to be conscious of individuals who are telling you that there is a finite window. And I think it's, of course, important to get as much rehab as you can. But I think I'd encourage you to recognize that day that you start getting rehab can be today, it can be tomorrow, but you just have to start it at some point. And
the part of the problem is that because of COVID,
yep,
the rehab originally, when he got out of the acute situation, the rehab setting, we weren't allowed to come in and see what they were doing or be involved at all. So when we got him home, it took 3 of us 70-year-old sisters and his wife to try to lift him, move him, and it was very, very difficult.
Yeah.
So
and then it runs being a risk for you guys for safety, right? Because if you're trying to move someone in a dependent position, that can be quite challenging for you, just orthopedically, right?
Right. But it's very helpful seeing Robert. Thank you for doing this, to see like you're many years out and you're still, working hard to get, a happy, purposeful life as best you can. And that's what we want for Tom. We just we don't know, nobody has suggested these kind of things for him. And so we're like swimming, upstream without a paddle. And,
Sure. Well, I think that's a really, I think what you say there is really an important aspect. And I think, it is good to have Robert and Jodi here to kind of, tell their.
Rob too was, he ran the New York City Marathon 11 times. He used to paddle surfboard in the ocean and bicycle, and very athletic. And I think
How's that nut?
but you don't.
Sounds like our Tom.
He can do it. And really, there's really nothing wrong with his muscles. He has to start working his muscles. Even it's the connection. So you have to find we have an awesome trainer that really gets it. And he's treating him like an athlete and not a stroke victim. And I think that's what your nephew needs. Somebody that's going to treat him like an athlete. Even before COVID, we were going to for occupational therapy. And when we first went to this place, they said, well, we don't do stroke. And so we said, well, we want you to treat him like an athlete. And so, these people had they worked with stroke people in, their rounding when they were in school, but then when they treat him like an athlete, I think they saw better results.
Yeah, I think this is an important point. I think, Jodi, and also for you, Betsy, I think it's important to have the right people, right? I think there's a number of individuals across the country that can help you in your path of recovery. And I think fundamentally, we know exactly what you have to do to get as much out of it as you can. and that is do the intense repetitive task practice. We know that is right now the gold standard. I wish we had more options, but that is really the fundamental driver of long-term recovery, long-term progress, and that's what is very well entrenched in the literature. And if there are multiple ways to get that opportunity, get that rehab, get that therapy. But as you mentioned, Betsy, one of these issues is with respect to COVID, a lot of those mechanisms by which you would normally get it are closed off. And
you don't have the knowledge level to say,
yep,
why aren't you doing this? Why aren't you doing this? Why
Yep.
aren't you doing this?
Yeah, and that's what we're trying to do here, right? We're trying to become a resource to give people, like,
Yeah.
if it's not with Motus, that's fine. We know it's not necessarily for everyone, but we want to be a good resource for everyone to know that, hey, the importance of that repetitive task practice is underscored. You have to. That's really the only way we know to get those long-term recoveries. And so I think one thing I want to mention, you brought up this really important thing about you want him to have a sort of happy, fulfilled life and improve his function. I think that's such an important aspect to kind of latch onto. And what I want to underscore is the fact that it's improvement from where you are now, right? It's not just like, hey, I will have this goal to do X, Y, Z. It's you need to have the goal of like, hey, this is where I am right now, and I want to have these iterative goals on the way. Like, hey, I want to have reduced tone. Hey, I want to become a little less dependent. And we need to have those iterative benchmarks that can help us stay motivated, because maybe it's good to have that goal of being able to walk independently, right? Or for Robert to be able to run the marathon again. But let's have some goals between where we are now and where we want to be. I think that's the important aspect, because
I think because it's a right-sided brain injury where the impulse control and his ability to actually to be able to say baby steps, Tom, it's okay to do baby steps instead of saying, I want to walk across the room.
Yeah. And that's an issue with safety too, right?
Straighten it.
Yeah. And you guys, and this is a challenging thing to manage because there are safety concerns, right? Because what happens is if you have that impulse control and or issues there, and you run the risk of having an orthopedic injury on top of this, right? And that's even more complicated to deal with. So I do encourage you guys to continue to remind him that it is important to maintain his own safety if he wants to have those long-term goals, right? He has to, and there are strategies to get around that as well, in terms of making, kind of little contracts, right? They're kind of cool, like behavioral contract techniques that you can use to help kind of keep.
Like I have a bicycle with a three-wheel bicycle.
Yeah, exactly. That's a great option, right? There's always modifications to activities. That's a great one. So I think some really great options here. But Betsy, I mean, I think not having that access, I don't want that to be a deterrent for you and for Tom's whole care team, that he can't get better from now. I mean, he's 6 months post-stroke, and this is as good a time as any to start the process.
Right. So right now we have him. He's in a rehab facility. We're trying to get him into one in Boston, which is a little bit more higher end.
Okay.
That's got the a little bit more like Robert was talking about, the boot camp that will.
Sure. I mean, let me give you some perspective here, guys. Our single best treatment for stroke recovery is a therapy called constraint-induced movement therapy at present.
What is it again?
Constraint-induced movement therapy, CIMT. And constraint-induced movement therapy is very, very intense, 6 to 8 hours of therapy a day, right?
Yeah, we went to Philadelphia. They would actually cast his left arm.
Oh, yeah.
That's so it's called forced use therapy, guys. And
but he didn't qualify.
Sure. Yeah, I think
there are
criteria that you have to have in order to actually do this.
But qualify at first because he had the heart issues that had happened as a result of the stroke.
Uh-huh.
Yeah,
we had to wait till the heart got stronger before we could.
And I think there's a reason why individuals don't qualify for this. Is that is you need some generally speaking, those individuals need a minimum amount of movement in order to actually do the tasks. And this is actually, so the Motus Hand, Motus Foot were born out of constraint therapy, not only because it was too costly and not scalable to the number of individuals who need the help, but you had to have those minimum criteria. And so
Right.
right now with the Motus Hand, you can actually engage in these activities and you don't necessarily need to have a minimum amount of movement.
That's what I was going to ask you. Does
Yep.
this apparatus, if he does, like his left arm is relatively flaccid, he has no mobility whatsoever in it.
Yeah,
but it
so like I said, you don't have to, there's no minimum criteria for the amount of movement you have to have. I think it's going to be very hard for us to make a prediction on the exact amount of improvement you have. And that's true independent of where you are on the movement spectrum. I think it's just challenging to know kind of a crystal ball where things are going to go. But for something like the Motus Hand, you don't need to have X number of movements in order to engage in those activities. The Motus Hand has that muscle inside of it that's housed inside of the black shroud here that can contract and relax. And this can offer a range of amount of assistance. So if you start off and you need all the help, the Motus Hand will kick in there and provide all that help. And as you begin to gain more independence, that assistance will go down and you'll become more independent by definition. And so it kind of can adapt with you as you progress. And ultimately, the hope is that you'll graduate from something like this and you'll then just start to have normal function, right? Because that's our ultimate goal. We want to have people use the tool when it's available and helpful for them, and then progress on to normal daily life activities.
Is this something that would be covered by insurance?
It's a great question. We are working on that actively. There's a lot of steps that are in play with respect to how insurance dictates coverage.
Is it FDA approved? Because we went to Rob had a doctor's appointment and like he asked me, I didn't just assume it wasn't, especially Rob's on Medicare for disability.
Sure.
But he said, is it FDA approved? And I'm going to look into it. And
Sure. Yeah. So yeah, the thing is the FDA does not approve these sorts of class 1 devices. What we do is it's a class 1 device, which means it is the lowest risk possible. So it is FDA class 1 device. So we have that it's not like approval like a medication gets approved. The FDA handles things in different categories differently. Now, with respect to the way that insurance handles things, despite the fact that we have all the randomized trials and these all the scientific data, that is not sufficient to address the insurance issue. Insurance companies prefer to have they have a different standard. It needs to be an economic answer for them because they're incentivized based on the amount they're going to pay individual, payout for individual beneficiaries. And so there's a tricky sort of threshold that has to happen. We are pursuing that right now, and we have been pursuing that for some time. And it ends up being quite a battle to get this approved, but we are pursuing that at present. Let me give you a quick example of this, and I'll have to go on here just a second. The the CPAP machines is a great analog for this. So CPAP machines were used or are used for sleep apnea, and continuous positive airway pressure machines. And early on, insurance did not cover them. $5,000 to $8,000 systems, and the first couple thousand people basically paid out of pocket for this until there was enough deployment out in the real world to tell the insurance companies that, hey, individuals actually cared about this and wanted it. It was helping outcomes in the real world, and that's when they actually were able to get the code to get that reimbursement. And so we're kind of in that period where we're trying to get that real world deployments to help inform that.
Do people use them while they are in a acute rehab setting, like in a downtime in between?
Can you say it again, Beth? Sorry, that was a little bit.
Right. So if we got this device for Tom to use in his downtime, like right now he's in an acute rehab facility, and it's 3 hours, but it's off and on. If his wife could plug him in and during downtime when they instead of watching TV or whatever.
Yeah. Oh, yeah.
Your PT is going to have to bless it.
Well, I think this is a good question. I think, you're exactly right. We do want to have some version of buy-in from all the medical side. Now, I think it's there's a tricky aspect to dealing with this in inpatient, and you do want to have the kind of blessing, but it's good to have some, some buy-in. There's nothing that would stop individuals from using this in inpatient rehab. And I think, as you mentioned, in like a skilled nursing facility or an inpatient rehab facility, you're getting at a maximum like kind of 3 hours of therapy a day, kind of by definition.
Right.
And so there's a lot of hours that are kind of latent there where you're not actually doing active rehab. And so I think it's certainly an option, but we need to make sure it's a good fit for that individual and that individual healthcare facility. Because they are the ones technically driving the care.
Okay. All right. Well, that'd be something we could ask, if.
Totally. Yeah. And again, I'd be happy to talk with any of those therapists, either therapists, occupational physical therapists, or physicians. I'm happy to have these conversations and talk, get into the weeds about the science or any of the efficacy or safety profiles. Happy to do that too.
What we've been finding is the physical therapists and the occupational therapists are all gung-ho about everything. But when
Sure.
you get up the line to the administration, there's where the kibosh is.
I think that if I were to give you some high level guidance, I'd say that provided it wasn't going to cost the administration in that facility any more money, you'd probably get their blessing.
Okay.
Also, you have to make sure it's going to be in a safe environment. So like people won't come by and damage it. And you'll have to have enough room for the screen and a table in his room. I don't know how it's set
I
up.
was thinking that because they only let one person at a time when my
Yeah,
sister
now
who is
Copen.
inside goes in.
Yeah.
While she's sitting with him, she could like hook it up and have him sit there.
Well,
Yeah.
usually they have like a rec period.
Well, no, they're not let out of their rooms, I'm sure.
Yeah.
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 Well, this is really great conversation, guys. I think what I'm going to do, I'm actually going to quickly go
Okay.
over to our next guest. I think I have Rosemary on. So Rosemary, can you hear me? Hopefully, Rosemary, you are.
Yes,
we go.
I can hear you.
Hey, Rosemary, how are you?
I'm very good, very good.
Excellent. How can I help you today?
Well, actually, I am listening in for my brother who had a stroke just the end of January of this year because of COVID also. And we just got the hand monitor, or no,
The Motus Hand, yeah,
yeah, hand mender.
sure.
Just when was that? Monday night. But we were able to use it or test it ourselves, me and my husband, because my brother is not able to move his right arm.
Okay.
So we were able to deliver it to him the following night, Tuesday. So ever since he told me just earlier, because I have encouraged him to join in the Zoom meeting.
Okay.
He told me he has been using it every day, but we were not able to check if he's able to use it properly. But
Sure.
because he had a doctor's appointment, like 3:00, I think he's still on the road somewhere. So
Sure.
yeah,
I
so
think we were alerted to that as well. So I think, yeah, I'm looking at the data now, and it looks like there has been some use on the Motus Hand. Now, to
Yeah.
answer your question specifically about if it's being used correctly, it's going to be hard for me to tell without actually being able to talk with Robert.
yes, that's
So
why.
I think maybe what we can do is we can schedule Robert and both of you actually to come on maybe on Monday or the next Wednesday on our next Power Hour, and we can actually go through an assessment and make sure things are going well.
Okay, sure, yes. The tips actually that you showed Robert,
Yeah,
my brother's name is actually Robert also, so that's why
Yeah.
sometimes I'm confused.
it's convenient for me. I have to.
Yeah.
If I get one name right, I'll get both of them right. But if I mess the
Yes.
one up, I'll get both of them wrong. So
Yeah, so yeah, the tip that you showed Robert was actually helpful, and my husband was actually telling him to align his wrist
Yep.
on that wrist. So yeah, so far, at least you're able to see his performance or progress.
yes, yeah, we're seeing data come in. Yes, so we are getting that.
Okay, yeah, because I'm not able to, so I can only ask him and just like kind of trust, like, oh, you're doing it right.
Yep.
So yeah, yeah, but definitely, I'm gonna have him join today,
Okay.
and then we'll go from there.
Okay. Very good. That sounds great. And I guess, Rosemary, do you have any questions for me outside of that? And I guess actually this might be useful for everyone too. I think what we'll try to do, I actually made a video about this. I know whenever the Motus Hand or the Motus Foot shows up, there's a video of kind of the standard way to put on the systems. That doesn't work for everyone. I understand that. And I think there's two extremes where you're kind of either on the more flaccid side where there's not a whole lot of muscle activity, and then on the other side where it's maybe a lot of tone. And both of those sort of endpoints can be challenging. And so what I did is I went ahead and actually created a video here at the office about how to put it on one-handed, even if you have a lot of tone. I think the same sort of process works for you if you have if there's a lot of plasticity too. And so there's some kind of really key tips and tricks in that video. And so what we'll do is we'll be sure to send that out. I think I'll try to get it linked in the Facebook group here and the live stream. It's also, I believe it's on our YouTube page too, but all after the fact, after the Rehab Power Hour, I'll be sure to post it in a couple of places and send it out to you guys that are here as well on the Rehab Power Hour. And so hopefully that will be a resource for you guys. You can kind of review it just a couple minutes.
Okay. I have like I guess a question between the flaccid and tone.
Sure.
I don't know if I'm understanding it correctly. Like flaccid would be just loose and not able to move, and tone would be like stiff, right?
Exactly. Yeah. So the tone, so there's people often will get tone and spasticity kind of mixed up. Spasticity is like, let's say I move my hand very quickly and it's going to cause, it can either cause a tremor, that's usually called clonus. But if you cause this movement, and you'll actually get a reflexive response against that. And oftentimes with stroke in the upper extremity, specifically in the arms and the hands, this will cause this flexion posture to occur where you have your fingers flex and your wrist will flex and your elbow will flex. Okay. And that tone is really just a change in excitability of the nervous system. And it's kind of a balancing act between our extensors and our flexors. And our upper extremity, our flexors are just dominant. They have more power and they kind of win that arms race, if you will. And the lower extremity is a little bit different. If you have tone, generally our extensors will win. And that's really just an evolutionary thing about we have to stand upright. And so our extensors are a bit more powerful than our flexors. And that's, as you rightly identified, Betsy, that's different than the flaccidity, in which there is really a lot of that activity suppressed. And so the nervous system is very, very low activation, and our muscles, by consequence, don't contract. And so it's very much like a loosey-goose kind of phenomenon where your muscles are very, very loose, and there's not a lot of actual physical tone, right, in the actual muscle itself.
Yeah, because well, my brother started out like I guess flaccid, like, and now because of no movement, I'm assuming because there's no movement and it's becoming stiff. But
it can. That's a very common consequence, right? What can happen is, and this is actually especially true if you don't do any movement therapy, right? Movement-based therapies, because what can happen is what you'll do is you'll find yourself, if you're very loose and you find yourself in a very constant posture. For instance, if you're in a wheelchair, or if you are not moving your upper extremities that much, you'll adopt maybe a flexed posture about the elbow and maybe a flexed posture about the wrist. What will happen is it's actually quite costly for our bodies to maintain organs, muscles being one of them. And what will happen is if you adopt a posture for a long time, those muscles and those tissues will just adapt to that new posture. If you don't force them to move, they won't actually allow that movement. And so they will actually just physically shorten, and that will become their new posture. And so you'll get this tightness that can occur secondary to the flaccid injury. And so it's a little bit of a strange process, but it's really coming down to the fact that you're not doing any movement to stimulate those muscles to keep their normal length. Yeah.
Well, fortunately, because he actually started out with the whole right arm, not be able to move, but we kind of force. I don't know, because his insurance problem, he's not able to get any therapy. So we're kind of researching for him, like in YouTube and all that, and that's actually how I found this product, your product. He's able to actually raise his right arm now and maybe bend his elbow a little bit, just no strength. But his frustration is not being able to move the wrist. So we're just blessed to encounter Motus Nova, the wrist movement. So but with a few days that he's on this product, hopefully he's diligently using it so that you know.
And I am seeing some nice movement here. So in terms of what the Motus Hand is reporting, I am seeing some really nice ability to move, which is good. So I'm encouraged by that. And I do want to quickly, since Jodi and Robert and also Betsy potentially too, and you, Rosemary, about you guys collectively, I think it's good to monitor things as you go on, right? The hand mentor, the Motus Hand, will help you track like the movement kinematics and kinetics, like your forces and your movements and your precision of movement. But it's also good to track functional things. So if you can, also maybe pick 1 or 2 tasks that you are really motivated to do. Videotape yourself right now, before you start doing something new, and then you can track that progress. That can be kind of your benchmark for, hey, have I progressed? Can I do things that I couldn't do before? And I know, because the reason this is so important is because the changes can be very small, right? And we live within ourselves, and it's kind of hard to see those changes unless you have some external perspective. And so it could be something that would be really good for all of us to do, really, to kind of track our progress, whatever it ends up being. So I just encourage you, Betsy with Tom, get some video, maybe of him doing some transfers or trying to stand up. Maybe Robert with you and doing some functional tasks you really care about. And I think the same thing with you, Rosemary, with the wrist function too.
Okay.
It's be a really, really powerful thing. And I guess I'm going to quickly go over. I think actually, let me first reintroduce everyone and just remind everyone we're kind of coming down to the last couple of minutes here, and we'll probably go over as we usually do on Rehab Power Hour. But I want to remind everyone, if you have any questions or comments, do post in the live stream here. I'll be watching those questions come in. I do see a couple things here from Simon in the actual live stream. I'm asking about whether this will help with playing bass again. I think it's a really great question. Let me just take a quick moment to answer this. I think if I'm understanding you correctly, are you talking about upright bass, like classic bass or guitar? I think in either event, we know that the Motus Hand, through the clinical trials, have been able to help individuals regain fine motor skills through some of the outcome measures that we actually evaluate. Now, of course, we haven't evaluated its specific effect to help with bass or guitar function or bass upright bass function playing. But I imagine that because a lot of those tasks are at the wrist and the fingers, that it would provide some assistance there. So it's a great question, Simon. So thanks so much for that. I'm going to go over to our next guest, and I think we have Zoltan here. Zoltan.
Zoltan Segedi.
Hello.
How are you?
He has received one. I don't know if it can be the first one. He probably overused it because he doesn't want to take breaks. So
I apologize, guys. I actually can't hear you very well. I don't know if your mic's a little bit far away, but if you wouldn't mind maybe moving the mic a little bit closer.
Sorry, it's better now?
Yes. Do you hear me?
I guess I can hear you. Yes.
Yes. Okay. I have the foot mentor.
Okay.
3 days ago, and I realized this is too slowly. Maybe that's the fee I have to have. But I want to go down, then you can see how it works. Yes.
I think I'm having a little bit of trouble understanding you, Zoltan. I apologize for this. I'll try my best. Okay. So using the foot mentor.
Yes.
And
very slowly, and it is possible to repair. Yeah,
sure.
Very neatly. Do you think is it all right?
Okay. So if is it only moving you a little bit? Is that what's happening?
Yes, yeah, a little bit.
Okay. Maybe what we can do is actually, Zoltan, this would be something good to check. So one thing I'd love to do with individuals, if you just got the foot mentor, it sounds like a couple days ago, what we can do is we can do a quick assessment to see exactly what ranges of motion you do have. And I think one of the most important things is to make sure that the foot mentor is fit for you. So if you're Yeah, if you're finding that the foot mentor is only moving you a little bit, maybe we need to
Yeah.
readjust some of the settings.
What?
Some of
Yeah.
the settings.
Yes,
Yeah,
yes.
so we can-
Who can do that? Who can do that?
We can do that. We can do that on right now, I guess. If you have your
Yeah.
okay, I guess we can do that. Do you have your foot mentor powered on?
Yes, everything is on. On.
Okay, very good. Now, if you just give me just a moment, Zoltan, I'm going to go ahead and get a couple of things set up on my end so I can actually give you some help here. Okay. So, Zoltan, what do you see on your
name.
Okay. So, what do you see on your screen right now, Zoltan?
Which one?
On your screen, that's your hand mentor or your foot mentor console.
My foot mentor.
Do you see a begin therapy?
Meeting. Keep
Meeting. Okay.
Please.
Okay.
Please.
Give me just a second here. Let's see here. Okay. It looks like we are. Okay.
Under my name, my vice frame.
Okay. So you're in it looks like you're in a game right now. Is that correct?
Young man, yeah.
A strong
Yes.
man. Okay, very good. So go ahead and hit play for me, Zoltan. Go ahead and hit play, and let's actually go through a couple of them. So I'm going to see if I can get some data here, guys, and we'll take a look. We can actually do one of these sort of impromptu in-game assessments, and we'll see exactly what's going on. Okay, Zoltan, are you? Is it playing right now? Okay, there we go. Got data.
Yes.
Okay, very good. So what I'd like you to do actually right now, Zoltan, is go ahead and try to move down and up, complete the tasks for me. Okay. I'm gonna have you press down as far as you can. Press the toe down like you're in a car and you're driving the car. And you're trying to press the gas pedal. Okay. Okay. Very good. And then I'm gonna have you just let me see this really quickly. Actually, I'm gonna on the top left. Go ahead and press the screen for me, Zoltan.
Yes, excuse me.
Can you please press the screen to pause? And then in the top left side, do you see the home button? It's a little house.
Yeah. Yes.
Please press the house button.
Yes.
Okay. And then what I'd like you to do is on the bottom left-hand side, there's a telehealth button.
Yeah.
Please press that.
E.T. Get it. Sorry. Name.
So once you press the telehealth button, there should be 3 buttons that pop up. There is an assessment button. Do you see that?
Yes.
Please press the assessment button.
Yes.
Okay. Now on the left-hand side,
Yes.
Zoltan, you should see something that says live angle. Do you see that?
Yes.
It has a number that's kind of fluctuating around probably.
Yes. 1486.
Very good. That's exactly what I see. So we're on the same planet, which is good, Zoltan. Very good.
Yeah.
Okay, very good. So now I want to do something really quickly for me. Can you actually move your foot down as far as you can?
Move it.
Can I?
Move it.
Okay. And then I'm going to have you move your foot up as far as you can. Okay, very good. And then relax for me. And actually, one thing that might be helpful, Zoltan, is can you move the camera so I can actually see your foot?
Yes.
That would be wonderful.
I told you.
Please. Okay, very good, very good. Okie dokie. Now can you tilt the camera down just a touch? Okay, now Zoltan, let's go ahead and press the gas pedal again for me, as far down as you can.
Done. And but don't help with your hand. Don't cheat.
Oh yeah, no
Just
cheating.
your foot.
No cheating at all.
Just your foot. Just your foot.
I love it. We got a policewoman in the house. I love it. Okay. No
Oh,
cheating.
it's been only 9 years.
Okay, very good. Okay, Zoltan, I'm gonna have you move your foot up as far as you can for me, please.
Up.
Beautiful. Okay. Now, there's a couple of things I think. On the left and the right-hand side, there are two little blue switches. Do you see the?
Also, you're right. What I wanted to tell you. Yeah, yes,
Switch where? Oh, it's this?
this.
On the left, yes, on the left-hand side. So on your right-hand side, I apologize. I'm looking at so keep going on the far side of the foot mentor over there. It should be on the
It's this
side.
one, this button.
Yep, those two buttons, they kind of switch in and out like this.
Oh, it has to be, I can't move it. It's too tough to move.
Okay. There's only two positions that it can operate in. One is going to be pushed in, the other one's going to be pushed out. Okay. So there's two of them. So Zoltan, you have the one on your left-hand side. Go ahead and press that one. And then on the one on the right-hand side, press that one as well.
Yeah, and then press the other side. You have one in the other side too.
Correct.
So and then this one, right,
Okay.
this is for the right foot. Okay, so I
Very
pushed it
good.
in, the
Very
right
good.
side, pushed it in.
So what we'll do, guys, really quickly, quick systems check for me. Both of those buttons should be going one direction. Okay.
Hey.
Okay, so
Okay. Now, Zoltan, now I want you to go ahead and move your foot down for me as far as you can here.
done.
And then I'm going to have you move it up as far as you can.
Up, now up.
Very good. I think that's much better, Zoltan. That's a lot more movement. What do you say?
Yeah.
It's good?
Yeah, yeah,
Very good, guys. Okay.
yeah.
So now, Zoltan.
Oh,
Okay, I think we're good. We can go back up to, well, I love looking at the foot mentor. I want to see Zoltan too. I want to see, so now guys, this is a common thing that happens. And so if this happens with you, if you're using the foot mentor, those buttons can get pushed. Okay.
yeah, yeah.
And it's designed to actually have that ability to restrict that movement. The
Yeah,
reason
yeah.
being is, imagine if you are working on your right-hand side and you have a lot of instability in your foot and your ankle.
Yeah.
We don't necessarily want you to have that inversion, what's called inversion instability. You can imagine it's very much like rolling your ankle. So we want to have the ability to prevent that. But if you have both of those pressed in, that will actually just stop the movement, and you'll experience this problem that you're having, Zoltan, where it kind of feels like it's moving a very small amount.
Yes.
Yep.
Yes.
So we want to avoid that. So I think this is the quick systems check. We want to make sure all the hardware is good to go. And I think from your data right now, it looks like you are getting that full range of motion.
Yeah, yeah. Thank you very much.
Of course, Zoltan. This is easy peasy. I'm glad we could do this.
Thank you. Thank you.
Sure. Well, actually, Zoltan, while we're here, if you want to quickly go through something, let's go see how much movement you have, and let's go set those settings.
Yeah.
Okay. So what I'd like you to do is I'm going to have you press the foot mentor down as far as you can for me. And no cheating. Don't use your hands.
Yeah.
Just push it.
Very good. Okay. And I'm going to have you, okay, very, very good. I'm happy with that. Okay. And I'm going to have you move up as far as you can. Beautiful. Okay. Okay, so I'm fairly happy with this, Zoltan. I'm going to actually make a couple of adjustments. I'm going to move your range of motion. That way it's going to be a bit harder for you. Is that okay?
No, because that's too hard. Right? Very good.
Okay, very good. A man after my own heart likes it to make sure the rehab is hard enough. Very good.
Yeah.
So I'm going to make a couple of adjustments here.
Sure,
Increase that range of motion. And what I'd like you to do, Zoltan, is let's work the next couple of days. Go through the movements, go through these repetitions on your exercises. And what I want you to do, I want you to come back on Rehab Power Hour in a week or so, and we'll see if these changes are good. Okay.
Yes. Thank you very much.
Yeah, no worries, guys.
Yeah, thank you. Ooh.
Okay, very good, Zoltan. Yeah. And apologies, kind of a misunderstanding there at the beginning. I'm glad we got ourselves on the right track though.
Yeah. Thank you.
Okay, very good, Zoltan. So thanks so much. That's great.
Thank you.
Okay, and I'm actually going to quickly, I know we were going over a little bit past our time, guys, so I appreciate you sticking with me. I'm going to go over to Marlene real quick. Marlene, can you hear me?
Yes, I can hear you.
Hey, Marlene, how are you doing?
I'm doing great, thank you.
Excellent.
Yes.
First of all, I hope you're having a great Friday. I know it's kind of late on Friday evening. It depends on where you are, but tell me who you are, where you're calling from, and how can I help you?
I'm calling from San Jose, California, and I was interested in this device for my boyfriend. He's 61, suffered a stroke October 1, 2020.
Okay.
And just like Betsy's loved one, it's very similar. He's been
Okay.
in the rehab since. And due to COVID, there's been some issues. There's been setbacks with insurance.
Yep.
So now we're paying out of pocket just to keep him active. But we hope to bring him home on June 1 because that's where we'll have some living situation set.
Okay.
But so we're just trying to find things that we could use at home and
Sure.
also maybe some outpatient stuff. But while we're doing dinner or something else, he can, stay active and
Sure.
continue his therapy. What I found is that Jerry is motivated and he has
Okay.
energy. So he's determined. So that's what gives me more hope that whatever the doctors say is not true. Because they did say that, because right now the right side of his body, the arm and leg, is having some issues, where it's not real mobile. He's in a wheelchair.
Okay.
And he has aphasia where he can't formulate his words.
Sure.
But they had said that he had plateaued and that the right side of his arm, wasn't going to be moving, just the fingertips. But he raises his arm on his own.
Okay.
He's able to do that now. So whatever they say, but I think, like I said, time is precious and every day it's different.
Sure.
So you just have to keep everybody motivated, including yourself.
Mhm.
And I think one day it'll just be better.
Yeah. Well, thanks so much, Marlene, for that story. I think, you have the right perspective, I think. And this is, and I guess I'll first of all just say thank you for just sharing. I think it's important to get these stories out there, and I think not everyone has this insight. And this is a soapbox that I get on many times, and I think it's unfortunate that many in the medical field have this perception that stroke recovery stops at 6 months or 9 months or a year. I think if we're honest with ourselves and we look at the data are fairly clear, in which case you can recover many, many years after a stroke. I think, of course, it's a big determinant, right? It's a factor that's involved, but there's many individuals here that are using the hand mentor and the foot mentor now that are progressing, making meaningful improvements in their life and their function, and they're a decade plus after a stroke. And in particular, that's been a large portion of what I've done in my scientific and clinical career, is worked with these individuals. And so I think that you're exactly in the right mindset. And I think you're in a good position where you're trying to identify that transition. Those transitions can be really challenging when you're going from an inpatient setting, when you may have those sort of resources at somewhat easy disposal. And then when you're going to a home environment, it can be much more challenging. And so I think you're in the right mindset, trying to identify, hey, when we get ready to change settings, when we get ready to discharge home, let's have those resources and those options available. That way there's no downtime, right? Because the downtime, the consistency, you probably recognize this too. If you mentioned with COVID having change in that consistency, you probably see some difficulties there. Having that consistency is super important. In those transitions, that's where we often get a big hit to that, right? Going away from 5 times a week, multiple times a day rehab to maybe at best a couple times a week for minimal amount of time. And so we really need to latch on to as much rehab as we can at all times. And so this is an opportunity where you can use this technology to help in that transition, to help maintain those high doses of care, or even potentially increase those doses of care. Even right now, we have many individuals who are getting kind of 10, 15 hours on the Motus Hand, the Motus Foot, and some individuals are even getting more than that. And so I think you're in the right time frame to make these decisions. So any sort of go ahead. Sorry.
Just a real quick comment.
Sure.
Mostly I was relating to Betsy because I dealt a lot with the rehab center, and they have their own ways of doing things and they have the insurance. And I've tried to introduce other things to the center, but you really just have to wait until you come home, because some of the things it won't work because they don't have the opportunity to spend as much time as you think with one person at a time. So I think just planning, so when he does or go to a better facility, like you mentioned, but not giving up, because there are so many other options out there.
Yeah, that's exactly right. I think, you identify this as Jerry having some significant motivation. I think that is a key determinant, right? So that's really good characteristic that he has. It sounds like Tom has that as well, from Betsy's perspective. So I think it's really latching onto that and really trying to help facilitate that motivation, right? If that's one of the key drivers, the internal motivators, right? Because, truth be told, if you're not the stroke survivor, we can help you, we can encourage you, we can provide all the resources, but you have to really have that ability sort of intrinsic in you to do the movements and to do the work. And so, I think it's a great comment, and it really resonates with me.
Thank you.
Yeah. And so I think, is there any sort of specific questions you have about maybe how it could be used? I'm happy to talk about my experiences or the science of the data. But I also just want to be a resource for you now and for your family going forward. So ultimately you can make a really good decision, right? That's really what we want to have happen. And so whatever you guys and Jerry decide as best, we want to help support that any way we can.
Thank you.
Sure. So I do encourage you guys, I know if you would like to come back on Rehab Power Hour, you're more than welcome to ask more questions, bring your family members or care partners there as well, and be happy to answer their questions as well.
Yeah. Well, I'm going to get this device for Jerry in June, so you will see us back.
Yeah. And I think, one great thing, like with Zoltan just on and Jodi and Robert, I think it's really good to touch base early, right? Because what we can do is we can make sure things are set correctly, and we can make sure that you guys have a good situation, good understanding. We can make sure all your questions get answered. And that way you got a good, solid baseline foundation, and you guys will be set on the right trajectories. And then that kind of also establishes a nice relationship. We know each other. We can kind of do checks in, and we can make sure that progress is continuing. And when we need to modify things, we can modify things. So
yeah, and
I look forward to that.
This in-person virtual way of working with each other, and the fact that you can go into the device and make these adjustments, that's pretty incredible, because you're not left home alone just trying to figure it out on the telephone. So
and I think that was one of the game changers, right? Like if we're honest, when we first started doing hand mentor, foot mentor approaches, it's been going on for the better part of 20 years at this point, and we had to do them in person, right? But now since we made these changes, right, it's made it a lot easier, right? I can work with anyone across the country, across the world, right? Basically, geographic distances don't matter anymore. And so we can work with anyone and help them remotely. So I think that's a really great way we can help individuals.
Great. Thank you again.
Yeah, of course. And so, like I said, I'm looking forward to working with you guys in the future. So I'll keep it on my calendar in June. I look forward to seeing Jerry and Marlene back with me.
Thank you.
Okay. Well, very good. I actually have one final question here, guys, before I wrap up tonight. I have a question here from, I think it is Todd Young in the live chat here. It's a really good question. Will this help with grip? I presume you mean grip strength, Todd. So let me know if I am understanding you correctly there. This is a good one. We've actually evaluated this explicitly in some of the clinical trials. So part of one of the actual measures we do in these outcome measures, these clinical trials, what we do is we, before individuals will start using the Motus Hand, the Motus Foot, we'll do a series of like a battery of tests. And these battery of tests do a lot of things, like a bunch of tasks, for instance, like picking up a paper clip, or folding a towel, or picking up a can of soda, or even picking up a thing like a shopping cart full of weights. So it's sort of a range from fine motor to gross motor function. And when we also have in that a strength assessment, where we actually get, we use a tool called a grip dynamometer. It's a fancy word, basically means, can we quantify how strong your hands are? And in fact, we do evaluate that. And lo and behold, we see individuals having improvements in not only their range of motion and their movement capabilities, but also the strength. And so, yeah, exactly right, Todd. We do expect to see improvements in that strength. So thanks so much for that. And also, it looks like I have maybe one final question here. I think I realize it's been quite busy in the live stream here, so I apologize, guys. So it looks like we have a question here from Don. So Don, first of all, thanks, Don, for being here. We've had a couple of conversations in the last couple of Rehab Power Hours to fill you guys in, and Don's interested in looking at his MRIs pre-post between using the Motus Hand. And so here's his question, guys, for everyone. Can a standard MRI comparison reveal any new neural pathways or synaptic connections? If not, is there a way to accomplish this? The reason I'm asking is that if neuroplasticity is provable, it would be extremely motivating. Ooh, Don, you are exactly right, Don. I think this is a good question. And so maybe what I can do, Don, is give you a little teaser of an answer right now, because honestly, it's going to take quite a long time to really unpack this and to really get into the weeds here. So to answer your first question, can a standard MRI comparison reveal new neural pathways? And unfortunately, the answer to that question is no. An fMRI cannot reveal individual neural pathways, nor will it reveal activation. So there's a thing I want to let you guys understand, or I hope you guys will understand, is that there is structure and then there's function. And these two things are kind of related, but they're also a little bit separable. And so let me give you a quick example of this. You can have two neurons that are physically connected to each other, okay? Well, not physically connected, they're connected via synapse. And we would call that structurally connected. And we can evaluate this, not at an MRI level, but we can evaluate this at a thing called a DTI, which is a dynamic tractography, which we can do this from fMRI, a special type of MRI. But we will not be able to tell with the standard MRI whether or not when this neuron fires, does this neuron respond? We won't be able to tell that. We have to use a thing called functional MRI to actually do this. And the truth is that we actually cannot evaluate this at the individual neuron level, the MRI. I think last Rehab Power Hour, I brought up this concept of kind of the scale of where you can see things. And so neurons are quite small, right? In the brain, they're between 20 and 80 microns, maybe 50 microns in diameter. Their synapses are much less than that. And MRI has a resolution down to around 1 millimeter. So we're a couple orders of magnitude away from that possibility. And so MRI gives us a view of like us standing on a satellite, looking down on the United States, looking at like all the lights at night. That's the kind of view we get. We don't actually get down to the individual home of the individual light switches that are on and off, unfortunately. And so we have to use much more refined approaches to get at those individual synapses. And those are very, very challenging, if not impossible, in humans. And so what we can do, though, is we can take broader approaches with MRI to evaluate connectivity, the functional evaluations. And maybe what I can do going forward is talk to you about maybe in a future Rehab Power Hour, Don, and I hope you'll be amenable to this. And we can maybe talk about the kind of scales at which we can evaluate things and how we can kind of, let's say, prove plasticity. And I think as maybe a bit of a teaser, we can talk about the receptive fields, or how big an area is responding to certain types of stimuli or movements, as opposed to maybe the functional connectivity, the connectivity between regions. I've kind of alluded to this in the past, but maybe we can get into a more formalized discussion. And so if that would be useful for you, Don, I'd be happy to do that in a future Rehab Power Hour. But let me know in the live stream if you guys would like me to get into those details. We even have a paper that I published a couple of years ago at this point about those connectivity maps. And how there's causal flow between various regions of the brain. And I can kind of talk you through how we could actually go about indicating positive support for the existence of neuroplasticity following something like the Motus Hand. So guys, let me know in the live stream here, and if you think that would be useful or helpful for you guys. And I think maybe Don, you and I can maybe chat offline about how we can go forward with this. But it's a great question, and I could talk for hours about this stuff. I mean, maybe even years, right? It's some of my most passionate things. So very happy to get into those details. So I guess what we'll do, guys, is we'll probably end for today. I want to just quickly thank everyone for being here. Been some great questions, and I love the ability to help you guys with your Motus Hands or your Motus feet. And so I'm really glad we get to do that. And I want to remind everyone that we have our next Rehab Power Hour scheduled for Monday at 8 p.m. Eastern Time. So do join me there. If you have any questions or comments over the weekend, feel free to give us a call at 404-594-4244, or you can email me at rehabpowerhour@motusnova.com. I'll be looking forward to seeing your questions there. I guess that will be it for me, guys. I hope you have a great weekend, and I look forward to seeing you on Monday. And bye for now.